All right, we are recording. So today we have a couple of cool new products that I wanted to share with all of you guys. I have Jim here. He has the Capt-all. That's the main product we'll be talking about. It's basically a unique product for the new regulations that are coming up, and that will be going into effect in July. I'm sure all of you have heard. It's all regarding amalgam separating. So I'm going to stop talking because it's going to be pretty cool. Jim, I'll hand it over to you.
Sure, appreciate it. I'm Jim Langlow with DOVE Dental Products. Been here since day one. So we are a roughly 6-year-old company. We really pride ourselves on disposable evacuation products. And roughly a year ago, we met a gentleman who had created the product Capt-all. And Capt-all is the only handheld, disposable, recyclable, so you recycle the contents inside it, HVE tip that is an amalgam separator tip that is compliant. So, and we'll talk about that as we move forward, but just to bring you up to date on amalgam separators, the different types that are out there. Obviously, everyone's familiar with the ISO style. So ISO are the backroom type amalgam separators. That's where all the evacuation goes to it, and then it separates the amalgam. And that's the traditional style. So back in 2017, the EPA looked at the ruling, which they came out with a final ruling and said, well, you know, a lot of updates are going to be coming to this space. And chances are they might not be in the back room. They may be where the amalgam's being removed. So that's where Capt-all fits in. And they created a category called the equivalent device category. So for your customers, when they purchase a system, whether it's us or an ISO style, they have to fill out a one-time compliance form. Okay, and on that form, it's exactly what it says. They're complying one time with whatever system they decided to get. And there's sections on there that actually dedicate themselves for equivalent devices. And there's a ruling, it's 441.30, Section A, Section 2, that gets into the details of equivalent devices. But long story short, they have to be able to collect a minimum of 95%. Capt-all collects 95.4%. And then they have to be recyclable. They have to meet the best management practices, which we meet all of those. And we have sample forms on our website, which is dovedentalproducts.com, under the Capt-all section that kind of walk you through how to fill out a one-time compliance report. But to show you how it works, most of your offices probably are using just valves like this. So they're using HVE valves, or they're using long neck HVE valves, which are a little more traditional. Patterson, a lot of times will sell ADEC, which are shorter versions, and then replacement valves are going to be longer. So to use Capt-all, it is used on demand. So it fits into any standard HVE valve. It still uses your same ons and offs. It hangs the exact same way you would a traditional HVE tip. And then it's used per patient. So they come individually wrapped. It's a really cool product how it's packaged. It's 25 in a pack. Inside here, they're all individually wrapped with instructions for use. And then literally in the last week, because of demand, we introduced a 75 pack. So the 75 pack is going to be a little bit bigger than this, obviously. And then the way Capt-all is used is once it's in a patient's mouth, after the usage of removing an amalgam, you then recycle it. So inside each Capt-all box comes a waste container. And on top, there is a little screw-in nozzle with a plastic liner that your used Capt-all tips go right inside. Once this is full, we send the customer a return ship label. So we give them everything they need to do. There's no extra fees. There's no extra charges for recycling or shipping. It's all included in the one-time kit. So 25 tips along with a waste bucket. I believe it's $177. And then we have a 75 pack that came out, and it's $508. It's a bigger bucket. It supports 75 tips. Okay, so Capt-all tips will fit. I just threw away my one tip there, of course. One tip will collect 1 to 3 removals, so anywhere in between there. So it has a lot of room. You're not going to be going through a ton of tips on a removal. Made pretty simple. After use, again, put it in here, or if you need a second tip, they're individually wrapped. You just take them out and grab another one for use. So it's really made for the office moving forward. So if you think about amalgams, each dentist is saying they're doing less and less removals each year. So, this year they may be averaging 25 to 35 a month. Some may do more, some may do less. Pedo offices might do 2, may do 1. So it really fits into that space. And then moving forward, if you start with a 75 pack, eventually you may move down to the 25 pack as the removals lessen over time. So meets compliance. It's disposable, single use, but also recyclable for the amalgam portion. It's extremely safe. So we know that when you remove amalgam through traditional methods, the way it works is once amalgam goes through your valve, down the line, it goes into the chair side trap. In that chair side trap, there are multiple studies that show 60 to 70% of amalgam sits in that chair side trap. It never makes its way down. So if you're using a traditional ISO style, you have to go back up and remove that chair side trap debris. Also recycle the back room debris from an ISO style. Okay, so great example is you use a Capt-all to remove an amalgam. Look inside that chair side trap. It's going to be virtually empty. It'll be wet with liquid, but you won't see any of the traditional discolored amalgam inside there. So you can see firsthand, it's doing what we say it's going to do. It's extremely effective, and it doesn't take up a lot of room. There's no installation. Just a real simple, easy product. And it roughly about $7 a tip, $7 a use.
Nice. Yeah, what I really see a benefit is some of those utility rooms that are really tight already.
Yep.
Where they may not even have room for an amalgam separator, or if their vacuum happens to be on the roof of a building, where are they going to install it? They would install it either on the roof or in a cabinet down in the office. It just installation
You're right.
of the standard amalgam separator is sometimes a little difficult. So this definitely fits that need as well.
It does. And then the other thing with traditional amalgam separators, you just have your customers talk to each other, and they'll tell you the good, bad, and the ugly. They all have a good intention, keep amalgam out of the waterways. The bad is there's maintenance. And when that traditional style tank fills up, most of your customers will call it a sludge. It's prophy paste, it's blood, it's saliva, it's amalgam a little bit. Most of it's back in the chairside trap. But then you have the maintenance of putting on, the respirator, the gloves, the gas mask, everything you need to go back and just change that simple filter. Whereas Capt-all is done right at your chair side before it gets extremely dangerous. Obviously, removing is dangerous, but it's immediately out of sight. It's immediately placed into the waste bucket. And that's our goal at Dove, is safety first, disposable products, but do it efficiently with newer technology is really the goal.
Nice. Awesome. Well, thank you for that.
Yep.
Let's talk briefly about the Saliva Ejector that you have that's debuting.
Yeah, sweet. So actually today, and
Very cool.
So it's a hybrid. The market has changed in the last 3 months, as we've both seen. We were closed, and then the CDC came out with brand new guidelines, and the new guidelines state, don't do any aerosol, any type of procedures that contain aerosol, stick to high volume HVEs, try not to use saliva ejectors right now until we can kind of control this aerosol movement. And that really prompted us at Dove to kind of think outside the box with what we traditionally do. Obviously, about HVEs. They're the most effective instrument right now when removing aerosols. The challenge is if you're working in the mouth, a typical high-speed handpiece going at 300,000 RPMs still has a ton of, did I lose you there for a second? Someone called here.
Yep, there you go. You're back.
So the traditional high-speed has a ton of aerosol that's produced. So you can capture most of it with an HV, which is why the CDC is recommending it. The issue is it still escapes. Ultrasonics, it's going to escape. This is going to be really effective right around the tip, which we all know. So when recommending only HVE, there's a lot of discomfort. So if you hit tissue with an HVE, it's kind of an aggressive little instrument. Some of the other devices that you'll see out there, big mouth guards. Mouth guards are cumbersome. They're not the patient's most favorite object to put in their mouth, and it can cause the gagging, but they can control some aerosols. But you're changing or you're compromising how the workflow's going on. The other ones are the big separate evacuators that you're seeing now, big shields. They got to be within 2 to 3 inches of the patient's face to be actually effective. So you got to get those real close to the patient. Sound is an issue, and then space, like we talked about earlier with amalgam separators. Bringing in a shop vac into the operatory can be very challenging. So we looked at all those issues that are created with the aerosol, and then we realized we've got a great product right now in the HVE market. So our HVE disposable valve is used widely out there. It's very effective. It's always clean because it's disposable. But we also know there's a ton of power coming out of this little guy. And the one thing that is not being used right now that you can't use are saliva ejectors. So we combined an HVE valve called the DOVE Aero with a saliva ejector. We shortened the saliva ejector by roughly 1.5 inches to get us closer to the patient. And then at the tip, hopefully you can see that, we put a 360-degree aerosol collection that works right outside the patient's mouth, close to the patient. And you're using a very well-known saliva ejector for access. It still creates all of your twists and turns. You still have all of your on and off features. The other neat thing is all of these new devices, the DOVE Aero, are going to have backflow preventers. So if my patient were to close around here, there's no risk of anything going the wrong way. And none of the other aerosol collectors or devices have that yet. So we're the only ones with a full HVE valve, backflow prevention, disposable. So I just take it off and pop on a new one. Fits on any chair. So we've got adapters that fit, whether there are ADAC chairs, DCI, there's all sorts of adapters that'll fit any chair around. And last but not least, they're made in the USA. So we make everything here in our Phoenix plant, that we're not in a challenge for getting parts. We're not going to be on any back order or anything like that. Everything should be ready to ship in the next 3 weeks. We presented it to Patterson, like I mentioned, Friday. So we're working to get it into the catalog there. They'll be sold in 100 packs, and they will be sold in 1,000 per case. Disposable, roughly $2 a pop is what it's going to boil down to. But you'll have an aerosol collecting HVE saliva ejector combo with backflow that now is right at the chair side. You don't need installation, and very simple, quick product to use. And you can still use it in combination with the traditional HVE. You're not reinventing the wheel. They fit on the same connector, so you can just swap them out if you need to during your procedure. So pretty excited. Lot going on. You know, again, DOVE Dental, disposable products, safer products, all about evacuation, and just trying to increase safety at large for the entire evacuation market. So
awesome.
Hopefully that helps.
Yeah, thank you very much, and thank you for your time. Hey, if anybody has any questions out there, where can they best just go to your website, or where's the best to get answers to their questions?
Sure. So we do offer samples as well, and sample requests or specific questions you could send them to sales@dovedentalproducts.com, or our brand new website is up and running now, and it changes daily because we have so many people working on it, but it's dovedentalproducts.com. And there's a form that they can fill out there as well for submission. If someone requests a product, they usually go out the next day. So we're very quick turnaround, and all of our products right now are stocked, with exception to the DOVE Aero, which will be stocked shortly at Patterson Dental.
Awesome, very cool. Well, thank you again. I appreciate your time.
Thank you so much.